Hey, welcome back to our podcast, Project Brightside, where we always look on the bright side, even when things are looking pretty dark. I'm Dr. Shelby.
And I'm Richard Brito, and we're your hosts for today's episode.
Topics of discussion for our podcast include society and culture, education, and TV and film.
So each episode of season 2 will have an interview of a guest speaker, followed by a Bright Talk segment where we discuss a complicated topic in hopes of shining light on it.
For today's episode, we'll be interviewing Tachina Emile, Bachelor of Science in Nursing and registered nurse. Hey, welcome to our show today. How are you doing?
I'm doing good. How are you guys?
Doing well. Thank you so much for joining us, friend. I'm excited to get through these interview questions, have a really nice Bright Talk, bond, catch up. So to get us started, tell our listeners a little bit about yourself and your interests professionally.
My name is Tachina Emile. I am born and raised in Naples, Florida. I moved to Tallahassee in 2017 for college, and then I studied my Bachelor's of Science at FSU, and I got a minor in psychology there.
Woo.
Once I graduated, I worked. I stayed in Tally for about 2 years, where I worked at HCA Capital Regional, and then after 2 years, I moved to Clearwater where I now currently work. I'm in my fourth year of nursing as a labor nurse. I currently work at Morton Plant Clearwater, and I'm on a travel assignment.
That's
Yeah, that's a
phenomenal.
little bit about me.
Yeah, and honestly, like what you do is very, very important, especially with like the climate, maternal mortality has been rising since 2022 because of like abortion bans and a lot of people might not really know what to do if, keeping up with the law and whatnot. So
Mhm.
I'm really proud of your perseverance and what you do is super important. So thank you for sharing that.
Yeah, thank you so much. I was gonna say, I think my husband was also born at Morton Plant Meats in Clearwater,
Oh
so
my God, no way. That is so
yeah.
crazy.
So that's fun. I was gonna ask you kind of what made you choose your career path?
Growing up, I always knew I liked human sciences. I always enjoyed like learning about that. And then when I was in high school, I was like in a vocational high school college. It was kind of like you took your high school courses, but at the same time you took like a course that prepared you for like a career that you could go into immediately after high school. And my career program was a licensed practical nurse. So we took courses and we did clinicals. So when I went out to clinicals, I was like, wow, I like really like, learning about this and just helping people and just making a difference. I just didn't know what kind of nurse I wanted to be, but I knew I liked helping people and studying sciences. I went to FSU, and then like FSU like has a notoriously like very, very competitive nursing program. And so like halfway through I was like, I'm not gonna lie, like I don't think I could do this. I got so scared. So I switched to like a criminal justice major. And I spent like, I think I took like two classes and I had no idea what they were talking about. Like they were reading statutes and all sorts of things. I was like, I'm gonna go back to my roots. So then I transferred back to nursing and I got my bachelor's from Florida State University. And then I took a internship course at HCA Capital Regional. And that's where I did labor and delivery. And it was like the coolest thing ever. I had never in my life seen a woman be born. I always just saw, like growing up, I would see pregnant women, and then like a couple weeks would go by and they weren't pregnant anymore, but they had a baby. But I never knew the process like that went into it until I, of course, like took courses on it and did the internship, and it was just so breathtaking, and I was so in awe of the women, the process, the medical staff that I knew that's where I wanted to be.
Honestly, when we were going through the prereqs together, back in the time when I wanted to do nursing, you were always overly qualified. You knew so much, and I always like tried to reassure you that like you're gonna make it. Like you're definitely like this is your passion, and you're so much more advanced than a lot of people that are applying. Not to be shady like to other people that are applying, but you really are super, super talented, and the way that you learned the material and you were able to remember it and like create these like really cool ways of remembering. Like I really appreciated taking classes with you. I felt like I was growing with you. I'm grateful that you're a nurse and that you're a labor and delivery nurse and you've accomplished your goals. And I know that you still have a lot more goals that you want to accomplish and be like a nurse practitioner. And you've always also wanted to be a travel nurse. So like I'm excited for what your future holds.
Thank you. I appreciate that. Yeah, we had a lot of fun in nursing school. I don't know if it was fun in the moment, but looking back, it was fun. Just making memories and bonding. But yeah, we definitely went through some times in undergrad.
Yeah, and you got through it, so I'm proud of you. So, what would you say are the kind of day-to-day obstacles that you face, and how have you overcome them?
Personal obligations, of course, or like obstacles that I face is just, becoming better than the person that I was yesterday and learning to grow while also enjoying where I am at now. I feel like it kind of applies to everyone, but definitely to me because each year I'm trying to better myself in my career, my academics, finances, which I feel like I've been doing that from the beginning since I decided to go to nursing school and just really kind of taking that into my career and being better, not only for myself, but also for my patients. Also, another thing that some challenges that I face personally for me would, I guess I would say maybe like some time management, just because there's always so much to do. And sometimes I'm like, we have 24 hours in a day, but I feel like it's like 22 on some days. I'm like, where is the time going? So it always feels like there's so much to do. And I currently work as a night shift nurse. So I sleep majority of the day. And then at nighttime, I'm up and I work two jobs now. So basically just finding time to, of course, pursue my goals while also giving my pouring from a full cup to my patients, to my friends and families. Those things can be a little bit challenging.
Yeah, that definitely sounds like a lot, but I'm sure you could handle it, and I'm sure you're doing great. We sometimes could be like very harsh on ourselves, but you're stellar. Like honestly, like, and you do have to pour into your own cup before you could pour into others. So definitely prioritizing that self-care, mental health, and all those things that you do. Um, but that's very awesome. Thank you for sharing that.
Of course. I appreciate the positive affirmations.
Yeah.
All super real struggles for sure. I guess when you're facing these struggles and kind of going day to day, what things really drive you?
The main things that I would say drives me personally, of course, is like family, just because my family, I'm first generation Haitian American, and so I was one of the first people in my family to go to college and graduate, and it was definitely a huge culture shock, honestly, just doing that. But my family was like, they supported me 100%, 110%, and they were like the village that continued to pour into me even at my lowest times. So I feel like everything I do is because of them and really just kind of like I'm so appreciative of them. And whenever I know like I'm like feeling low, I'm like, my mom, my grandpa, my grandma, like they poured so much into me. So I really can't like, half do anything. I have to give them my all because the people who poured into me allowed me this opportunity to like be here. So that's one of the things that drives me, of course, and my community because I work with a very, very special community of women and birthing children. That's like one of the most greatest privileges and honors that I feel like I will ever have in this lifetime. And so I feel like to be the best for them, I have to like, always keep them at the forefront of everything I do, whether that's, pursuing higher education, making sure I'm up to date with evidence-based practices, just so I can deliver the best care because one day it'll be me in that situation. And I would
Mhm.
hope that someone is driven by being my nurse or being my provider and making sure that they're showing up as their best self.
Yeah, totally.
Um, and the last thing, of course, that drives me is just legacy, because the things we do now are the things I'll be left behind when we're no longer here. So just making sure I leave a legacy for my family and whoever comes after me.
Yeah, 100%. I see that. Very well spoken, very good core values that like drive you. Thank you for sharing that. So, what would you say are a few of your biggest priorities for 2025? So, like, I know we have like 4 months left,
I know,
but
like the year has gone by so quick. So
4 months? Wow, sorry, I was just taken aback by that.
4 months
Continue.
is crazy work. But yeah, a few of my biggest priorities for 2025, of course, is gaining extra certifications in the field of nursing, specifically labor. I'm currently studying for my fetal monitoring certification. It's basically kind of like this course that says that, you're certified to read fetal monitoring strips and basically just kind of understanding the pathophysiology behind labor and some of the complications that may arise and understanding like the responses to those complications. It's basically just like a really in-depth certification saying that, hey, like I am certified to do this and certified to do it well. Another one would be RNCOB certification, which is also another certification that delves into like labor and the complications that arise. So those two certifications are some things that I'm working on. And of course, expanding my travel nursing adventures. I'm currently a travel nurse, like I mentioned earlier, but I'm hoping to travel outside of Florida, possibly to like California, Washington, New York. I'm currently in the process of applying to a couple travel assignments currently in California. So hopefully by next month, I will be stationed somewhere out there where I'll be able to like, meet so many new people, learn a lot of things, and just like build upon my knowledge base. And I would say the last thing, of course, is returning back to school for my master's in nursing to possibly pursue a career in women's health as a women's health nurse practitioner. Yeah.
That's cool. That's so amazing. And you will have such a valuable perspective pursuing that degree as well with your experience in nursing.
Yeah, you could potentially, if you want, no pressure. But we are in that labor and delivery project, Tashina, with the women's health team for
Hmm.
GHCP,
Hmm.
and that's going to be taking place in Sierra Leone. So they do have a conference where they certify nurses, and because the infant mortality is really high in Sierra Leone, and the maternal mortality is also high. So like just some statistics. So in Sierra Leone, the maternal mortality rate is 443 deaths per 100,000 live births. And then in terms of infants, it's 75 per 1,000 births in
That's so
2019.
sad.
Yeah. And then when you compare that to the United States, the maternal mortality in 2022 was 22.3 deaths per 100,000. So developed nations, yes, it's still rising because of what's occurring, but in other countries like in Sierra Leone, like where rural health is disproportionately impacted as well, that could be an option too if you want to travel outside the United States. If not, no pressure, but you are a part of that, so we will be working on that labor and delivery scoping review and seeing like all around like what are the issues that are occurring in Sierra Leone, and then we could even expand that to the United States. But yeah, lots to look forward to, especially when you're applying to your nurse practitioner program. And these are things that you could talk about because you have so much experience already. You've been in it 4 years, going on to 5. So it's exciting stuff. You definitely have a well-rounded career ahead of you, and you're so young and so experienced, and that's just like so powerful. Just wanted to
Yeah.
share that.
Yeah, that's definitely something I would be interested in doing for sure.
Yeah, that's amazing. Thank you for sharing that, Richard, as well. That sounds like a really cool project. The next question, I think, we delved into some of this already, but what do you aspire to accomplish within the next 5 years? So a little bit longer of a timeline.
Yeah, within the next 5 years, I plan to, go back to school for my women's health, to become a women's health nurse practitioner. I'm kind of in between that, and some days, I feel like that's one of the reasons I haven't gone back is just because I'm so like in between. I don't know if I want to become a CRNA or the women's health nurse practitioner. I know I want to be at bedside. In labor, a lot of the times, our nurse practitioners mainly follow the patients in the office, and I enjoy being at the bedside with my patients. But I know about like 10, maybe 15 years from now, my knees and back may not enjoy it. So I'm still kind of like, deciding if that's something I want to do. I really enjoy it, but also being a CRNA, I spend a lot of time at the bedside with the patients, more so in a sense where I'm like, providing anesthesia and pain relief, which is another way to bond with the patients because that is a very important part of labor, especially if a mom's birth plan is to like, not necessarily feel all the pain and so associated with labor. So those are a few things. Hopefully within the next year or so, I'll be decided and working towards that. Possibly educate. One of my goals is to, teach perinatal classes to expectant mothers, just because there's so much miscommunication or misinformation out there regarding birth and like the trauma behind it. So maybe just empowering mothers, expectant mothers, or mothers who haven't necessarily had a baby in a while or it's their first time, just kind of helping empower them to know what to expect if there is, you know, something to expect because everyone's birth story is so different. There's no one linear way.
Hmm.
So really just teaching that. And then of course like teaching just kind of making support groups for moms surrounding mental or like trauma birth, emphasizing mental maternal health because birth can be very impactful, either positively or negatively on the maternal health. So really just educating moms prior to the birth, after the birth, just letting them know that there are options and they're not alone. And my last goal within the 5 years, which is a little bit more personal to me, would be just kind of like real estate investments. Because as I spoke about before, leaving a legacy, I also want to be able to like tap into like some professional or like personal professional goals of mine that does not include work. And that would be the real estate investments, just because I really am into property and just kind of like flipping houses and doing those things. So we'll see where the future takes me.
Yeah, that sounds super
Lots of-
exciting. I like the
Sounds busy.
diversity. Yeah, yeah, but it sounds fun for you because you've always talked about real estate investments. I think you mentioned it during nursing, like during your college years. Is that when it
Yeah.
came? Yeah, okay, good,
Oh my God, you remember so much from college
good.
where it was a blur. Like I was just trying to make it to the next day every day. It felt like. But yeah, it is something, it's a goal that I've had for a while. I think I've just kind of put it on the back burner, but I think I'm closer, I'm at a more appropriate time to like pursue it.
Yeah, yeah, I totally see that. So, what advice would you offer to those who wish to pursue a career like yours?
Yeah, to anyone that would wish to pursue a career such as a labor nurse, I'll start off with the basics, like of course, like remembering your why, understanding why you want to do this, and leaning in on it in the hardest times because it's going to be hard. I won't sugarcoat it. Understanding why you want to do it, and really just persevering, putting in the work, no matter how long it takes, how many times you have to start over, just keep at it because nothing that is, beneficial comes easy. So definitely like put in the hard work and never doubt yourself. Even if a door closes right now, it doesn't mean it's going to stay closed forever. And then I would, of course, say to, put yourself out there, try to do internships if you can, like get in with providers where you can shadow them, whether that's an OBGYN, so you can see the birds, or you could go to your local hospital, just be a volunteer, or you could even apply as a patient care technician to work on a labor floor, just so you're exposed to that environment more. So that you, when you get there, it's not too much of a shock, or it lets you know if you really actually want to do this. Being a patient care tech, I definitely would recommend it to anyone who wants to go into the medical field, whether it's to be a doctor, a nurse, whatever, just because not only is it a very humbling position, but it sets the foundations for you to like provide patient-centered care. Because sometimes when you just go straight into the hospital system, not everyone, of course, sometimes when you go straight into it without kind of like that building block, there's some foundational layers that are missed, and sometimes you might struggle, sometimes you may not, but I definitely think it's worth a shot.
So something that you reminded me of, your answers were, very similar in terms of like the core of what you're trying to say. Dr. Shivani, we had her recently on, I think it was like episode 2. I don't remember, but it was this season. And essentially she was talking like, she never saw herself as like a brave person, but
Hmm.
going into Obi-Wan, like she really did have to embody that like braveness because
Oh
it
yeah.
really is such a difficult job and all around like you could have so many unexpected terms and so many and it's embedded a lot with like emergency medical services.
Hmm.
So the fact that all around you have to have this like forefront of like, I mean for any profession in the healthcare field you do have to have this forefront of like knowledge and confidence and but it's just things could be so quick when it comes to procedures that like within minutes like someone could die so and
Hmm.
resuscitation and whatnot so yeah, I'm glad that you gave that advice and getting like early on exposure to build that confidence, to build that bravery of like witnessing things and early on. So like that when people do get into the field, as a nurse, their transition is a lot smoother. Or if that's, as a doctor or whatever it is that you're being
Hmm.
that provider, you definitely want to have that experience to guide you.
Yeah, for sure. I definitely agree. Absolutely. I always tell like when I orient like new people, I always tell them, this is single-handedly probably going to be like the most scariest day of this mother's life. So you and her can't both be scared. If she's scared, you can't be scared. And if
Yeah.
she's not crying, you definitely cannot cry. So it definitely takes a lot of bravery for this job, at all levels, really, because you see a lot. It's very rewarding, but it's also very humbling.
Yeah,
Yes.
and my mom, she struggled with me, so I think like the whole labor process was like 23 hours, and then I was 9 pounds, 11 ounces, and I was like 23 inches like in length. So,
Wow. Wow, you're a big guy.
yeah, yeah. So like all the situations could vary, and there could be so many complications as well. But thankfully, she didn't have complications. It was just tedious and very, painful.
Hmm.
No, that's great advice, and good insight from both of you. I think, you know, just going into whatever position you are in healthcare, there's something to be said for also knowing what the other members of your team are doing. I think sometimes it's easy to like not kind of know what their day-to-day is and to kind of lack that insight into their career. And so I think that also helps. I was a medical assistant and scribe before I went
Yeah.
into medical school, and so I feel like that has really helped me kind of understand how our team works and going into it. But
Hmm.
yeah, so definitely good advice. The last question for this section I wanted to ask you is, what's one book, TV show, or podcast outside of ours that you think everyone should experience?
This is such a great question. I think Well, I'll start off with a book that I think everyone should experience. I would definitely say, The Alchemist. It's honestly such a like mundane book. Like, it's really not anything like crazy, but I think it speaks to like a life lesson, which is basically just it's based off of a young man who travels through Spain and Egypt in search of his personal legend. And along the journey, he just finds signs in nature and just kind of like embodies them as he goes about his journey. And I feel like this is essential, really, in to anyone and anything that you do. There will always be signs. I'm like a Christian, so I go to church, and we always say there's a song that goes, "Sign and wonders." There's always signs, and I feel like there's always wonders. Like there's always so much to see, and the universe is always telling you something at some point. And I feel like if you focus on the journey is going to be long, but of course focus on the final end, but like still learn along the way. I feel like it just helps you so much to like build your character and just kind of like prepare you for what's on the other side. So that's definitely a book that I would recommend. A TV show that I would recommend for anyone who's wanting to become a labor and delivery nurse. It's called The Midwife. It's kind of like based in like the older days where basically kind of like the midwives would go to the expectant mothers' homes and basically just kind of like deliver them, and they would manage them throughout their care. Sometimes the mothers will go to the office, but most times the midwives went to them, and it was basically just kind of like this midwife who went around everywhere and on a bike at that, like these midwives. And they were so like, I mean, it's amazing. If you have no idea if birthing or like being in the birthing world is something that you want, I think watching that will definitely help solidify it. It's a little bit of a slow burn show, but I think and a lot of it is really real. Like, I know sometimes I watch shows where they do medical things, and you'll look and they'll have like, headphones in as like the nasal cannula or something, or like the monitors will be flipped upside down. It's definitely not like that. It's actually really realistic, to the point that I feel like sometimes like we might even incorporate it in our day-to-day life as a nurse. But I would definitely recommend that to anyone who's pursuing a career in OB-GYN, OB, obstetrics, maternal, just to kind of like give you a better understanding, because it's not something you see all the time. So those are the two things that I definitely would recommend.
Yeah, that sounds wonderful. I definitely want to read that and check it out as well. Okay, good. Thank you so much for the recommendations. So that's a wrap for the interview section. So for our next segment, Bright Talk, where we discuss complicated topics in hopes of shining light on the matter, this week we will be discussing a day in the life of a labor nurse. So I know that we've talked about general stuff, but this is going to dive deeper into a day in the life of a labor nurse. So with this in mind, let's start off with our questions for the Bright Talk topic. What inspired you to be a labor nurse? So I know you talked about it, but give us a little bit more details on that.
Yeah, so basically I was kind of unsure as to like which kind of nursing I wanted to go into. When I did my internship, or first to start off with clinicals, I was like stationed at this hospital for my clinical work. There was a C-section that day, and I was one of the nursing students selected to go and view it. Mind you, I've never been in a surgery in my life. Like I was like, wow, I mean, I think I was like literally shaking in my boots in the corner, like trying not to touch anything sterile. I was so petrified. And then I remember like hearing the baby come out. And because it's a tense environment, there's bright lights, everything's draped in blue, everyone is very structured. There's a it's kind of a tight air there until the baby comes out. So once the baby came out and took his first breath of air, it was like we all like let out it's like we were holding our breath until the baby took his first breath. And it was just like such a like breathtaking moment. Like I literally remember having goosebumps on my arms. I was like, oh my God. And like tears came to my eyes. I was like, I would definitely love to do this like for the rest of my life. And I feel like once I did that in clinical rotation, then I did my internship and it really solidified it because I was able, it's like 1 second you're sitting and kind of just evaluating strips, and the next it's like you're on an adrenaline rush where mom's coming in 10 centimeters, the baby's head's hanging out. Like it's just like so many cool things happening all at once. And the most beautiful part to me is really being an emotional support for those moms because, you know, you do it often, or the nurses, they do it so much day to day, whereas it's possibly that mom's first time ever doing this. And honestly, there's no one time is easier. Every time it's still very like, what's gonna happen? So really just being a rock for that, the family, support for them, for the dad, answering questions and just kind of being giving them a peace of mind. I feel like that was also a beautiful part of it that kind of propelled me to do it.
Yeah, that's awesome. And honestly, I remember when we were in the first 2 years like of the prereq era before you got into the nursing program, you were like basically the embodiment of the nursing model. Like your personality
You're so
literally,
sweet.
no, I mean it. I mean it. I always, whenever and that's how I knew that I wasn't a nurse because when I wasn't going to be a nurse, because when I would compare myself to you, I'm like, Tashina is actually like embodying the nursing model, like her nurture, her care, her compassion, like that in itself. Like I was like, oh, like sh this is totally like I was drawn to it because of how awesome you were. But then I realized like no, I have to actually like find my strengths, but
Hmm.
your strengths like were very clear from the very start. And I know that you wanted to be a nurse, but you didn't really know the specialty. So I'm glad that in the later half, during those rotations and the internship, you were able to identify labor and delivery. And honestly, it's so magical. And I know it's exhausting based on what you've said, but you're really impacting a lot of people's lives. And people are gonna remember, oh, Tashina was my labor nurse. Like she really helped me through it. Like you definitely embody like compassion and nurture. So thank you so much for sharing all of this. And this is definitely going to inspire people to pursue a career just from hearing your testimony.
Yeah, I appreciate your kind words. I really do because we were in this from the very beginning. So,
Yes.
Well, that's amazing. You talked a bit about, kind of being a rock or a source of support for families, which I think is absolutely true. What's one of your favorite parts about being a labor nurse? Is that your favorite part? Are there more?
I definitely enjoy being a labor nurse. Like, there's so many aspects to it, of course. I feel like the reward at the end, a baby, is so beautiful, but I also enjoy the science behind it. Just kind of like watching a mom from the very beginning who like may not be in labor, she may be in early labor, she may not be dilated, and watching how her body works with her. And, she progresses towards the end, and then she delivers this beautiful baby. And even in the complications of it, just seeing like the science that we have so readily disposable at our hands, the resources to basically kind of, you know, make sure we have a safe maternal and fetal outcome is really amazing. I always joke, like I'm in the interview process for these travel assignments, and there's like a labor nurse who like helps the mom deliver, or she may manage her care while she's still pregnant, and then there's a nurse that does mom and baby after baby's born, and then there's a nurse for specifically the baby. I'm like, give me the mamas that are still pregnant, that are ready to give birth. Like, I am all for that. Like, it's just amazing, honestly. And in the beginning, My first day was as a labor nurse was really, I mean, as any new person starts in a profession, you're like, I suffer from anxiety, so I was really like nervous. So I was like, "Are y'all sure y'all want me to like be off orientation? Like, are you guys absolutely sure?" They were like, "Yes, you're ready." And I just was like, I don't even know what I don't know. Like, but I asked so many questions, and then I feel like the first year to 2 years, I was still very, very scared. Like, I feel like I second guessed everything. I was so anxious. It was like sometimes I couldn't even enjoy being at work because I was so in my head. But now that I'm entering, and they call it like a new nerd, like a new grad, of course. Like you're like a novice, like you don't really know too much what's going on. But now that I'm entering like my fourth, almost fifth year of nursing, it's honestly like it's like I like fell in love with the career all over again because now, of course, I don't know everything, but I know more than I did on that first day. And I'm able to help my patients so much more. And it's like I don't feel 100% comfortable because I'll never fully know everything, which is the only way I'd feel 100% comfortable. But I feel like I'm in a growing place where it's like, I feel like, okay, I got my bearings in order. I kind of know what's going on, so this is good. But yeah, to answer your question, my favorite part of labor is literally the labor.
Nice. Yeah, that's awesome. Thank you so much for sharing. And I also like that you brought up the system of how there's a nurse for each of the different stages, because that's super crucial. Because I believe there's a lot of complications for postpartum, and a lot of mothers actually like die during the postpartum. So it's from each of the steps, they're very important all around, require, de detailed, dedicated attention. So I'm glad that that system where the infant, the during the labor and postpartum, there are different nurses assigned to continue that care. So we definitely need to solidify this foundation, and you sharing this like definitely will like the goal is definitely to inspire a stronger foundation and more people, applying to be labor and delivery, especially since what's occurring in the United States. But all around, like what's occurring in the United States is still not does not compare to like the magnitude of infant mortality or maternal mortality around in different places around the world. So very important stuff. Thank you for sharing that.
You talked a little bit about your first day, which I can definitely resonate with that as a resident physician as well. Still lots of questions, but how do you feel like your day-to-day life looks like now?
So my day-to-day life, it's pretty I would say like repetitive. Basically, usually I like sleep until about 3 or 4 p.m. I wake up. My goal is to work out after I wake up, but I'm not there yet in life. Hopefully one day I'll get there. So I usually prep, get ready for work. Once I get to work, I am usually giving my patient assignment, and then of course once given my patient assignment, I go and assess them and basically just kind of come up with the plan of care for the night to see what is our main goals, how can we achieve those goals, really address any concerns, questions that they may have, making sure that there isn't any new or drastic changes from what they were like before I got there, reviewing their fetal monitoring strip, making sure that their baby's okay, reviewing the medications that they may or may not be getting, their history, and then really depending on the patient assignment, it really can my night can vary based off of that. So if I have a C-section, then we're gonna, of course, be in the OR. I'll prep her. She is already prepped for the OR, and then we'll go to the OR, deliver her, which usually takes about 1 to 2 hours. Bring her back, recover her, making sure she's stable. Once her recovery is done, then I will transfer her. Or if my assignment that day is an antepartum, which is usually like a mom who she's too early to give birth right now, but she's also too sick to be at home just kind of chilling. So we'll like bring her in for monitoring where we kind of watch her closely. And then if she becomes more stable, then she'll be able to go home and finish off her pregnancy. Or if she's not stable, then the provider will make the decision if it's worth inducing her for her to have her baby just because she's too sick to continue to the end of the pregnancy. So usually if I have that patient, I'll kind of like run through their history and make sure that we're set for the night. Or if I have a labor, which is my favorite part, we're definitely like one on one in there. Like I'm in the room most of the night, doing all the position moves, really just help doing all the things we can to help get her body into that active labor while making sure that her baby is tolerating it and that she is also tolerating it in stable condition. And then a lot of my shift is spent collaborating with the OBGYN, my charge nurse, neonatal team, just to make sure that we're all on the same page.
Good. That's awesome. So I do want to ask you, have you done outside of hospital setting or clinic setting, a labor and delivery, like at home or
Oh no, no. I'm strictly to the hospital. I honestly admire home births, but I was trained for like in a hospital setting, so that's mainly where my expertise is at.
Okay, okay, sounds good. So I'm curious, what are the most dangerous complications you've had to navigate?
Yeah, I mean, there's honestly like a lot of different dangerous complications. The first one I would have to say is an amniotic fluid embolism for sure, which is basically just kind of like an embolism that travels like from the amniotic fluid, and it can be life threatening. I mean, most people who experience a amniotic fluid embolism do not necessarily survive, or if they do, they are in critical condition. It's honestly one of the scariest things, and research is still being completed on it just because like there's still so much we don't fully know about it. But I'm gonna look up the statistics to tell you right now.
Okay.
So it's very rare. One in 40,000 births in the United States, according to like the 2023 studies, had fluid embolisms, and most of those moms do not recover or survive just
Wow.
because it happens so quickly. The moment that fluid embolism travels, they basically just go into like a cardiac arrest and they basically like flatline. And if they're still pregnant, now your goal becomes to like, okay, well, if she loses circulation, the baby will soon follow. So I've lost one circulation, I can't lose the other. So it becomes like a focus, like, okay, we have to get this baby out as soon as possible. If it happens immediately after delivery, it's like, okay, well, let's try to maintain hemodynamic stability, making sure we have all the lines on her. It's honestly just a very stressful situation in itself. So I would say that's one of the most dangerous things that can happen. And one of the risk of it is really just kind of like if you have cardiac defects, cardiac issues, that might pose a risk, but really it just kind of, it's really at the random. It's like a pick of the straw. In 2023, 8.6 deaths per 100,000 live births were reported. But that would be one of the most dangerous ones that I would say that I've worked with. And then there's others, of course, like prolapse cord, where the cord comes out before the baby. That's pretty dangerous. And then
Hmm.
a uterine rupture, where basically kind of like it's not, it kind of, it is what it sounds like. Like your uterus just kind of tears from the inside, which is a quick emergency, of course. Those are the most dangerous, like acute ones. Like those are like, okay, like this is a medical emergency. But long-term ones are like ones that moms just kind of go throughout their care. I would say preeclampsia. That one is just kind of like elevation in high blood pressure that's characterized by protein in their urine or elevated liver enzymes. Those things can, that condition, if not maintained well, can become eclampsia. Preeclampsia just essentially means before the seizures. Eclampsia means the seizures. So if their blood pressures are not well managed, they are at risk for that.
Yeah, that's devastating.
Yeah, so one of the most dangerous complications, long-term ones, I would say, would be preeclampsia, which is basically a complication that's characterized by high blood pressure, swelling around face, eyes, hands, headaches, excessive weight gain, proteinuria, and sometimes there can also be silent symptoms similar to a lot of people who suffer high blood pressure. Sometimes you may not even know you have preeclampsia and you you do. It basically begins after 20 weeks of pregnancy, and it can lead to serious complications such as seizures. And if you do have those seizures, you're at risk for like, well, not even if you don't have the seizures, you're also at risk for like placental abruption, which is when that placenta starts to detach away from the uterine wall prematurely. which is also another medical emergency because that is that baby's lifeline. And really just, I mean, having a seizure with a baby that's intrauterine is never good.
Hmm.
And some of these seizures, if like they can go on for so long that, you can have like permanent damage, like vision loss because you have like retinal detachment, just all sorts of things, and even leave you hypertensive post delivery. Risk of preeclampsia would be, cardiovascular disease, having that long term, and another complication that it can lead to is organ damage, stroke, and things like that. Of course, if you have preeclampsia, you are at risk for having a premature birth. It's kind of like I was saying earlier, we have antepartum patients where they're too sick to go home and chill, and then they're not ready to deliver. So, for example, if you have a 32-week mom who is pregnant and she has preeclampsia, she has protein in her urine, she's got severe features, which would be like the swelling of the face, swelling of the hands, blurred vision, headache that's unrelieved by Tylenol. Those things would be signs for like, okay, well, is it worth carrying her to term, or is it better for her to like deliver just to get that baby out of that environment? Because once they're like preeclamptic, their body is working overtime to get blood to this baby. So you're at risk for having a smaller baby because your blood vessels were so tight trying to get blood all over, and especially to that placenta. If the preeclampsia is able to be managed because we're able to like, give you blood pressure medications, continually monitor those liver enzymes, the blood work, the protein. If those things kind of like, they don't go any further up, but they kind of go trend downwards. Sometimes we'll start them on an infusion called magnesium to basically just kind of like it decreases that neuromuscular irritability because one of the main complications of that preeclampsia is they're at risk for seizing. So when we start them on the magnesium, it decreases their body's like likelihood to seize. So that's one of the main ways we try to manage it. But really, if we're unable to manage it with those ways, of course, you're going to have a premature birth for your baby. And now your baby is going to have to spend an extended period of time in a NICU, which is not the worst thing, but we prefer for our babies to grow inside if we
Hmm.
can help it. Some risk factors for moms that are pre-diagnosed or that are diagnosed with preeclampsia is basically just kind of like some age range between 20 and 35 years old. Those moms, it's kind of, which is odd to say. It's like I feel like that's like the prime birthing like age, but that's one of the risk factors. And of course, one of the biggest ones is African Americans are at an increased risk for premature or for like preeclampsia. Really, our genetics and also access to care can play a role because if you're able to catch preeclampsia early on, you're able to manage it better and it doesn't divulge into such a disease that causes not the best outcome for moms. And being overweight is also a risk factor for it. Smoking, if you had hypertension prior, so if you had hypertension before 20 weeks pregnant, you would be considered chronic hypertension, which would definitely put you at an increased risk for gestational hypertension, which is basically kind of hypertension in pregnancy, and then gestational was definitely going to bring you into preeclampsia if you start having protein in your urine.
Like like for superimposed preeclampsia, you're saying of chronic hypertension.
Yeah.
Yeah, yeah, exactly. Yeah, no, it's a tricky balance for sure between, wanting to continue to give them time and not be early, but also
Hmm.
most of the time once we deliver, things do tend to get better. That's part of the treatment. Sometimes not. Sometimes it comes on after birth, but
Yeah, sometimes it comes on after, and it's like actually that's really one of the main leading causes of maternal death in African American women is that preeclampsia post delivery.
yeah. I just wanted to say one thing on that, that it is a really interesting, thing on how they get to these risk factors. And some of them make sense, right? Like if you're a G1 or this is your first pregnancy, we don't know, right, if you're going to be
Hmm.
exposed to it before or not. The part of being African American is one of those risk factors, and we only need two to start people on aspirin prophylaxis during pregnancy. Is interesting because race is a construct, of course, and then are we including people that are specifically African American or Black overall. And so, like you mentioned, I think there is a big access to health and kind of chronic trauma of being a a Black person in this country. And so I
Hmm.
think there is a lot that contributes to that. And, it's interesting because there really is not a genetic difference.
Yeah.
There can be, of course, with like, if you're coming from a specific country in Africa, but just being Black isn't going to, cause a genetic.
Hmm.
So,
And it's interesting working in the field because it's like, I mean, studies say one thing, which I totally agree with the studies, but then I'm in the field and I'm like, I feel like this doesn't really, it doesn't discriminate. Like, I feel like so many patients I have are really ill with this condition, and they sometimes come from all different backgrounds and all different ethnicities, but
mhm.
primarily, I said African Americans, but really just Black people.
Yeah, and another thing that came to mind is what Shelby was mentioning with like a construct, like a lot of the things like genetically, like where nature and nurture could like intersect. Like for instance, for those that are where malaria is prominent, it's the sickle cell disease was a mutation from that occurred due to like the presence of malaria. So having like sickle cell disease, there's like increased coagulation of blood, and you're more at risk for heat strokes, and those heat strokes could have a cascade of organ failure. So I'm curious, have you had patients where there were comorbidities like diabetes mellitus and sickle cell disease?
Oh yeah, for sure. The more comorbidities they have, it's like, for example, I'll read through the prenatals, and like I feel like the moment I read like diabetes or autoimmune, it's like I'm waiting for like the next, like the last part to say like hypertension somewhere in there. So for sure, comorbidities such as diabetes mellitus can definitely, or gestational diabetes can definitely increase that, just because your body is just in a almost in an unhealthy state, and it's
Mhm.
trying its best to like maintain a healthy state to like help your baby, but these things can definitely lead to that preeclampsia for sure, or like things such as lupus, autoimmune. I feel like a lot of my patients that I see with lupus are sometimes preeclamptic towards the end of their pregnancies.
Yeah, and can you touch up on the increased risk for postpartum cardiomyopathy?
Yeah, for sure. So, that postpartum cardiomyopathy is basically just heart failure that happens after pregnancy, and it can occur months, after the childbirth, up to 5 months. And sometimes the symptoms can kind of be like, mild, like, things that can appear as like pre-E, but then you run the test and everything just kind of keeps coming back like fine, everything's fine. They have those chest pains, they have swelling, headache, and really just kind of like overall not feeling well. But once we run our labs, the protein, liver enzymes, most of these things look good. And then suddenly, a mom who was complaining of these symptoms for a while suddenly decreases in her stability. So that's definitely a very, very dangerous complication associated with childbirth in general, but definitely your risks are increased if you have pre-E.
Yeah.
So it's very important to like raise awareness to that, just because similar to amniotic fluid embolisms, it's almost like something where still like research is still being developed on it. So finding those precursors to it, really running thorough studies, imaging of the heart, different things like that can help have better maternal outcomes.
Yeah, super informative. Great. Perfectly said. So thank you so much for sharing that.
Kind of going through all of this, what's something you wish you knew before and would like to share with others, or maybe somebody who is planning to try to get pregnant in the near future?
One thing I wish I knew before and I would share with others, definitely try to obtain optimal healthy habits prior to the pregnancy. Like I feel like when people are trying to conceive, we focus on maybe one thing, but it's really a lot of different things, pictures to it. Your lifestyle habits definitely play a role. Your partner's lifestyle definitely plays a role. Really, studies have shown that preeclampsia is kind of linked to the paternal sperm. So some moms will have a pregnancy that is like completely fine, and then they change the father of their baby, and they have like all these crazy issues. And we're like, well, what changed in this pregnancy? And they're like, oh, it's the dad. And we're like, well, I kind of knew that before you said it, but definitely your partner's health, your health are definitely important. If you could decrease smoking, increase your a healthy diet, decreasing stress levels, those would definitely help promote a great pregnancy. But at the same time, pregnancy is such a vast, the conditions are so vast, and sometimes it feels like you could do everything right and things can still go awry. But really, preparing before and during it, being your greatest advocate. If you notice something is wrong with your body, definitely access care, seek medical attention, valid medical attention, accurate ones. I would definitely tell that to people for sure because something that you might brush off may not be what you think it is.
Yeah, and something I saw online that I really liked, there's this like saying like if before forming a baby, like the man should like have like 9 months of like clean health.
Hmm.
And then they should then try to have a baby after that. And so like that the mother could then, create the baby in those 9 months. So yeah, great advice. I definitely see that, especially with the tie with the risk factors increasing if the male is not really taking care of himself and doesn't have the most optimal health. That could definitely complicate, the life of the baby
Hmm.
and the mother.
Yeah, for sure. The male is so important during like conception. I mean, they pick the gender at this point. Like it's there's so much more that they don't realize that they are able to that they benefit to like they provide to this situation with the pregnancy. So definitely taking care of themselves, taking care of their partner.
I know that with what you've said with this job, there's a lot of like uncertainty and you have to be able to like manage that. So any coping strategies you apply at work in moments of heightened stress?
Some strategies that I would say that I apply at work would be deep breathing exercises. Honestly, I spend maybe like 90% of my shift breathing with my patients, coaching them through breathing, and they don't realize that it's for them and me. So we definitely are deep breathing a lot throughout the labor process. And honestly, it's very important in like just grounding you and just, helping you come back down to reality, even if it's a stressful situation. It just almost to me it feels like it like resets. Like I take a deep breath and then I do the next thing that's in my control. I can move towards that, but when I take a deep breath, it's almost like a cleansing breath where I just kind of clear my mind and then work one step at a time towards the things that we can control. And of course, relying on my team is honestly essential. I feel like labor is so like team driven. Like it's almost impossible to do it on your own, just because there's so much that goes into it. So being able to like have a great team that you can rely on is so important, especially in obstetric emergencies, because it is not a one-man show. It is a lot of people in there. And of course, maintaining patient safety and comfort is at the core. Knowing that I can do something, whatever I can do to make sure my patient is safe at all times is always going to ease my anxiety. If I feel like something is just not safe for my patient, I physically cannot like continue with it. So I feel like staying true to maintaining my patient safety eases my anxiety because I know that I'm doing right by my patient and also by myself.
Awesome advice, definitely.
Yeah, that's amazing. To kind of wrap it up, and I know we went through some advice already, but any final advice to expecting mothers?
Just like I said before, try to acquire healthy habits before and of course during the pregnancy. Having a good support system I think is so important. It's not People don't realize just how important it is because a good support system will hopefully ease some of the stresses of pregnancy and then post-pregnancy. So that's very important to have. I feel like staying active if you can, definitely, especially if you are planning in a natural birth. The more active you are, your baby is able to get into the optimal position into your pelvis, which will definitely help labor progress as smoothly as possible. Which that's not always the case, but it's better to try it and find out that it is than to basically be idle the whole pregnancy. And of course, the most important is I would tell anyone and everyone trying to conceive or about to give birth or post delivery is just basically educate yourselves via trusted resources such as A1 or ACOG. I can never remember the acronym for it, like what it, like the actual full word. Let
For
me,
ACOG or for which one?
for A1.
Uh,
A1 and ACOG, really. Association of Women's Health Obstetric, which is the one the nurses follow, and then ACOG is more so the providers. Shelby, I think you might know that
I was
one.
like, I know the ACOG one. Yeah, that's
Yeah.
the American College of Osteopathic Obstetricians and Gynecologists.
Yes, I feel like those are reputable sources, or if we're looking at studies, basically just like things that are definitely accredited and tried with, valid case studies that apply to the situation. So I definitely would recommend those. I think TikTok is a great source for a lot of different things, but I would definitely say, it's a place that people share experiences. It is not science based. It is not always the most reliable. It can be quite scary, honestly, reading everybody's stories. So
Yeah, yeah,
I
I
definitely would
totally agree with that. And another thing, you did a great job explaining how there's risk factors, but then there's also protective factors, and often like there's a misconception of like, n not to be active, like to not really work out during pregnancy, but it depends. Definitely consult with your physician or provider to make sure that you can, work out and like what that process is like.
Yeah.
Yeah. You
Yeah.
definitely want to be, generally we say you want to be doing the same activity that you were doing before. So if you weren't like doing a bunch of weightlifting or you weren't doing a bunch of running before, then you typically need to check
Yeah.
your before doing those things. But if you were already kind of a slow but long distance jogger, then typically that's okay. But yeah, absolutely checking with your provider. And then that kind of goes to Sheena's point as well of starting those things early before you get pregnant, because then you're already doing them.
Yeah.
Yeah,
Yeah.
definitely. And when I say stay active, like, get out, take a walk, get some vitamin D. Definitely don't go jump lifting in the weight room if that's not something you normally already did. So I definitely agree with you guys.
Yeah, this has been a wonderful episode. Thank you so much. It was a pleasure having you and being able to have you on the show. It's been a wonderful conversation, and that's a wrap for episode 11 of season 2 of Project Brightside.
All right, thank you so much for having me.
Yeah, happy to have you.
Thank you so much for coming on. And thank you all so much for tuning in and supporting us. Make sure to recommend our podcast to your friends and family, and make sure to keep sharing. We have one more episode in the works for the rest of season 2. Until next time, take care. Episode 11 of season 2 of Project Brightside was executive produced by Richard Brito, Luke Riosti, Shelby Floor, John Scrivenage, Jake Riosti, Sophia Paez, Andres Gil Arana, and Zoe Rushetsky. Music by Jake Riosti. Edited by Luke Riosti and Richard Brito. Research by our research associate Margaret Lee, and a special thanks to Tachina.
Thank you so much, Tashina. It was wonderful. Take care now.
Thank you so much.
Thank you. Thank you
Nope.
guys for having
This
me.
is
So-
medical advice. Don't take medical advice. Thank you.
Yes,
Yes.
yes.